In home care, most of the patients are elderly. They have chronic diseases like diabetes, and they can be bedridden or chair-bound, and risk of diabetes, ulcers, and pressure sores are high. In theory, these wounds can be prevented or detected and treated early. However, we often see wounds occur and worsen very rapidly. Once infection sets in, the elderly is admitted to the hospital. This starts a cycle of admissions which deconditions the patients. Regular assessment and monitoring is critical for good wound management. This is not always easy at home due to a lack of experienced wound nurses and no monitoring platform. That's why we developed CARES4WOUNDS.
CARES4WOUNDS is a wound management application. It allows nurses to take images of the wound using a 3D sensor attached to a tablet or handphone. With the fingertips, nurses can measure the length, width, depth, and circumference of the wound. Wound assessments are recorded using an easy-to-use drop-down menu and picture references. Nurses can pick from a list of products for treatment and upload the reports real-time into CARES at Home, our care management application. Once uploaded, senior nurses can remotely review and supervise the care.
Wound management in home care can be cumbersome. Presently, nurses rely on paper rulers to determine the sizes of the wound, and documentation is handwritten. Progress of the wound is monitored manually, and trending is seldom done. This hinders the senior nurses from supervising treatment closely, as we are not always physically present.
With CARES4WOUNDS, we are able to overcome many of these problems.
My nurses use a tablet to obtain an image of the wound and determine its size at their fingertips. As for documentation, they use a drop-down menu with picture references. There is also a list of wound products they can consider for treatment. Their reports are uploaded real-time into CARES at Home, our care management platform. Nurses are able to view wound trends and previous reports. For less experienced nurses, I review the reports remotely with them. I can even discuss wound management plans with other clinicians and patients' family members.
Our wound clinical workflow is incorporated into CARES4WOUNDS. This ensures that every step from measurement, assessment, and treatment is done systematically. All information and reports are uploaded real-time and trended instantly. This lifts both quality of work and productivity for the care team.
Nurses like CARES4WOUNDS because it's so easy to use. The entire workflow is embedded so that nurses do not miss steps. The drop-down menu has standard data for wound assessment, which really helps newer nurses. The photo reference lets them compare their assessment against standards. All this builds efficiency and confidence in the nurses. In fact, I train new nurses on wound care using CARES4WOUNDS so that everyone is aligned. We can review their work real-time using reports uploaded to CARES at Home. If patients have diseases that affect wound recovery, we review the wounds alongside their other care plans.
CARES4WOUNDS is easy to use. It improves the quality of care and productivity of nurses because it can assess and monitor the wounds easily and seamlessly. I believe nurses can better manage wounds in home care, and patients can stay at home with quality and dignity.